Hey everyone! Today we're diving into a question I get asked all the time. Is pneumonia contagious? But before we jump in, let me be crystal clear. I'm not your doctor. This isn't medical advice. And if you're feeling sick, you need to get yourself to a qualified healthcare provider ASAP. This video is purely educational and meant to give you some talking points for when you have that conversation with your actual doctor. Cool? Cool. Let's go. What is pneumonia? So first things first, what even is pneumonia? Well, it's not just a fancy cold, folks. Pneumonia is a legit infection of your lungs. We're talking about the functional tissue of your lungs getting infected by either viruses, bacteria, or in some cases, even fungus. Here's how it goes down. Those pesky viruses or bacteria start partying in your upper respiratory tract, your sinuses, nose, and throat. Then through a process where you basically inhale them down into your lungs, they make their way deeper. Remember, your airway to your lungs sits right behind your esophagus, so it's easier than you'd think for these troublemakers to crash the wrong party. Once they're in your lungs, they start multiplying, and that's when cells and pus accumulate in your lung tissue. Fun times, right? Symptoms. The "you're actually sick" part. Now here's something important, and I can't stress this enough. If you have pneumonia, you are really sick. This isn't a case of the sniffles where you can tough it out. The mild symptoms? Fever and cough. But the severe symptoms? We're talking respiratory distress, sepsis, which is a whole body infection, headaches, racing heart, and muscle aches all over your body. And if you're an older adult, pneumonia can cause confusion or altered mental status. A lot of people confuse a common cold with pneumonia, but here's the truth. Pneumonia is an actual lung infection, and when you have it, you're seriously ill. The different types. Alright, so there are actually different types of pneumonia, and this is where it gets interesting. Viral pneumonia is caused by viruses. Think COVID-19 or the flu. These typically need supportive care, though there are some medications for specific viruses that can help reduce how long you're sick. Bacterial pneumonia is caused by bacteria, the most common culprit being Streptococcus pneumonia. This type needs antibiotics to knock it out. And then there's fungal pneumonia, which predominantly affects people who are immunocompromised or in areas where these fungi are common. And let me tell you, fungal pneumonia is no joke. It's often more severe than viral or bacterial pneumonia and usually lands people in the hospital. The big question, is it contagious? Okay, here's the answer you've been waiting for. Is pneumonia contagious? The answer is, it depends. I know, you wanted a simple yes or no, but hear me out. Contagiousness of pneumonia depends entirely on the virus, bacteria, or fungus that's causing it. It's all about how contagious that specific organism is. For example, COVID-19? Super contagious. That's why it spread like wildfire and caused so many cases of pneumonia. But other bacteria and viruses aren't as contagious. It's more about whether you have specific risk factors that increase your risk of getting pneumonia from exposure. Pneumonia is most commonly spread through droplets that pass from person to person. Think coughing, sneezing, or even just breathing near someone who's infected. Quick reminder here, folks. This is all just information to help you understand pneumonia better. I am not diagnosing you, I'm not treating you, and I'm not replacing your doctor. If you have symptoms or concerns, please see a qualified medical professional who can actually examine you and give you personalized medical advice. This is just meant to help you know what questions to ask when you get there. Who's at risk? So who needs to be extra careful? According to the research, you're at increased risk if you're younger than 5 or older than 65, and the risk increases the younger or older you are. Someone with chronic lung or heart conditions like COPD or asthma, dealing with chronic liver disease, a smoker or heavy alcohol user. Basically, anything that compromises your immune system or lung function puts you in the danger zone. Difference from bronchitis and colds. Now, let's clear up some confusion. Pneumonia is not the same as bronchitis or a common cold. Bronchitis is inflammation of your airways themselves, not the lung tissue. A common cold affects your upper airways, your nose, the back of your throat. Pneumonia? That's inflammation and infection of your actual lung tissue, and it's much more severe. Think of it as a progression. You might start with a cold, but if you don't improve or if your immune system is compromised, it can progress to pneumonia. treatment, and recovery. If you do get diagnosed with pneumonia, treatment depends on the type. Viral pneumonia, mostly supportive care, staying hydrated, resting. Bacterial pneumonia, antibiotics, usually for 5 to 7 days. Fungal pneumonia, this typically requires hospitalization and serious treatment. But here's the kicker. Even though antibiotics might only be for a week, recovery takes weeks. We're talking several weeks for symptoms to fully resolve, and chest x-rays can show evidence of pneumonia for 6 to 8 weeks. Prevention. Good news. You can protect yourself. The CDC recommends pneumococcal vaccine for kids under 5 and adults 50 and older, plus anyone at increased risk. Flu vaccine, COVID-19 vaccine. These vaccines are effective at decreasing your risk of developing pneumonia. It's not a guarantee, but it's your best defense. When to see a doctor? Here's the thing, and this is critical, don't mess around with pneumonia. It's the second most common cause of hospitalizations in the US. If you start having shortness of breath and respiratory symptoms beyond just a cough and fever, do not wait. The longer you wait, the more severe your pneumonia can become. And if you need hospitalization, your risk of a worse outcome increases for every hour you go without proper treatment. Talk to your doctor about any questions or concerns you have. You need a proper lung evaluation and exam, usually including a chest x-ray, to get diagnosed correctly. No home remedies are going to cure pneumonia once it's established. They might help your symptoms feel a bit better, but they won't treat the actual infection. All right, folks, we've covered a lot today. Remember, the big takeaway is that yes, pneumonia can be contagious depending on what's causing it. It's way more serious than a cold, and you absolutely need medical attention if you suspect you have it. But let me say this one more time for the people in the back. This video is for educational and informational purposes only. I am not providing medical advice. I am not diagnosing or treating anyone, and I cannot replace the care of a licensed healthcare provider. If you're experiencing symptoms, please reach out to a qualified medical professional who can properly evaluate you, run the appropriate tests, and create a treatment plan specifically for you. Use this information as a starting point for conversations with your doctor. Ask them about your risk factors, whether you should get vaccinated, and what symptoms to watch out for. Stay healthy, stay informed, and most importantly, don't try to tough out pneumonia. Get help. Thanks for watching, and I'll see you in the next one.